Go back 2, maybe even 3 years, and this is where a lot of people said the promise in the near term was AI in healthcare, the administrative task. But the round is big. I mean, what do you need $243 million to do?
Yeah, I think this round, $243 million, values the company at $1.25 billion. Now that round is led by Oak, HCFT, and Andreessen Horowitz, and with participation from OpenAI. I think it's a testament to this platform that we've built for health systems, which liberates clinicians from the administrative burden and enables them to focus on their patient. And a big part of it is we've built this sort of best-in-class platform, which in practice, what it does is before the patient walks into the room, the system actually summarizes all the context for the clinician so they know what's going on with that particular patient. In the visit, it's listening in the background. It's generating the documentation automatically for the clinician on behalf of them, right, as well as a summary for the patient and their families. And then afterwards, it's automating all the downstream sort of revenue cycle, coding and billing, prior authorization workflows, which is how health systems get paid. I think it's allowing us to essentially work with many more institutions. We work with some of the largest healthcare organizations, academic medical centers in the country, Cleveland Clinic, UCSF, Houston Methodist. I think this round is a testament to that
Nikhil,
work.
What's the company's core competence? I understand the platform, but what is it that you're good at that's allowed you to build the platform?
I think a big part of it is we've built an incredibly deep working relationship with OpenAI and other foundation model makers to build the most capable foundation models for healthcare and medicine. And we've taken that and packaged that into a series of workflows to help clinicians. So I'll give you one example. We work with Cleveland Clinic, one of the most subspecialized academic institutions in the country. They have 100+ different specialty and subspecialty areas. And you can imagine every single one of those specialists practices different medicine. They have different workflows. There's different administrative rules. And so what we've been able to do is create a platform that services the needs of every single one of those specialists. Over 80% of clinicians at Cleveland Clinic use the technology in clinic every single day for over 70% of those visits. And that's more than 2 to 3 times some of the other alternatives on the market.
Nikhil, go to that relationship, that working relationship that you want to invest in further with OpenAI. What makes your business defensible versus OpenAI just sort of building it themselves?
I think a big part of it is, as you think about sort of the gap between general purpose reasoning models and models that are actually clinical grade and compliance grade, there's a massive gap between models that truly understand the medicine that's happening in every single visit. We talked about Cleveland Clinic and other academic medical centers, just the level of depth in clinical reasoning that's happening across 100+ different specialties, and how that's different from primary care to if you have to go see an oncologist to even an oncological subspecialist who might specialize in a particular type of cancer. And it's bridging that gap in sort of the understanding and reasoning capabilities of these models that ultimately allows us to build software that really solves the problem for clinicians on the front lines.
We are currently, as we speak, just also seeing live pictures of President Trump, who is currently in Scotland. He's opened, of course, a new golf course, but he's also been negotiating with the EU, continues to be discussing relationships with the UK going forward. We're going to be diving into that as and when necessary for you. But let's just return to you, Nikhil, as we hear, of course, what President Trump has been doing. I wanted to go to the regulatory perspective here for your business at Ambience, because I am thinking immediately about healthcare requirements when it comes to privacy. How have you made sure that that's front and center when you're relying on so many different users who, well, each hospital has a different rule case, I'm sure?
It's a great question. I think the idea of how do we build AI that's safe, how do we do it responsibly, how do we roll it out in a way that's effective. We're lucky to work with some of the premier academic institutions in the country, and that's allowed us to build infrastructure not only to create and train AI in a safe and private way, but also the governance processes to roll it out responsibly. But I think the opportunity getting this right is actually massive. You think about the 10,000 seniors aging into Medicare every single day, the fact that in every sort of virtually every category of our healthcare workforce, we're projecting a shortage of 100,000+ people over the next 5 to 10 years. And we, as a country, spend $1 trillion on administrative waste. The opportunity to leverage AI to sort of help rehaul how the system works and have better tools for our clinicians and actually take better care of our patients is pretty exciting.